All right, so I'm here with a lovely patient of mine who we just realized that we're like twins or related in some ways because we grew up in the same town in East Tennessee. But you have had you've been in a unique journey in your life, and we got the pleasure of taking care of you. And I was just curious, kind of, how long did it take for you to kind of take the plunge to decide you were going to do something to address your needs?
I started thinking about it probably 2 years before I set up the consultation because I knew I wanted to lose some weight first and see what that was. And then I also wanted to start talking to people that had had things done similar to what I did to get some recommendations to know where to go so I could go somewhere that I could trust.
And what procedure did you end up having done?
I had an abdominoplasty with no muscle stuff, which was great, and a breast lift. I think that's right.
And it's important that one of the things I want patients to understand is sometimes when they get something like an abdominoplasty, if there is not separation, then you don't need to mess with the muscles. And actually, the surgery isn't as bad as some people realize. Was it a super painful procedure?
I only took one pain pill the morning after my procedure and never took another one.
Right.
So I didn't have pain. I was just uncomfortable because you can't stand up straight, very stiff, moving around. You have to be very ginger in your movements, but honestly, it wasn't painful. It was just uncomfortable.
Right. And what was the reason that you ended up having your breast procedure? Because I think that was kind of unique because it was more than just you just wanted to lift.
Right. I actually came in to have the underarm fat and extra tissue gone, and you suggested the lift because that would take care of it without having a big scar under my arms. And then in further discussions with you, I was extremely lopsided, like probably a full cup size, bigger on one side than the other.
Right.
And so now they are up and perky and perfectly symmetrical, at least to my eye.
Right.
And I'm thrilled, and it took care of this issue as well.
Right. And one of the things too is a lot of times patients report when they have big asymmetries like that, literally when you're wearing a bra, you have to buy the bra that's sized to the size that's bigger, and then the other one is sitting in there and not occupying the space. So is that issue gone now?
Yes, it is. The difference is just incredible. And I had been not symmetrical since I was a teenager, so I'd always hated it, but just never really thought about getting it taken care of until a few years ago. So I love it. Wish I'd done it sooner.
What was the worst part?
What was the worst part? The drain.
Right. And then what's been the biggest surprise?
The biggest surprise was how quick I was able to get back to my normal life. I love doing reformer Pilates, and I was able to get back in there in about 7 weeks post-op.
That's awesome.
So that was really nice. Again, not having to do the muscle tightening, I think, helped a lot.
Right.
But yeah, it was much easier than I thought it was going to be.
That's so awesome. And but how crazy is it? We literally lived in Johnson City at different times, but
In the
basically a couple streets away from each other. The world's a small place.
It is very small.
Awesome. Well, thank you for sharing.
Of course. Thank you.